It's really daunting when you first get to see the cadavers because they keep the face covered for kind of modesty purposes, and you just peel back the sheets and just see this dead body effectively lying there. And it is quite scary at first, but by the end of the 2 years you're in there so often that you just get used to it and it becomes really normal. Hi, my name is Chloe and I'm a 4th year medical student studying at UCL. I looked at applying at Edinburgh and Leeds and Cambridge. The reason I wanted to come to UCL was because I wanted to be on a campus based in central London, and you have such great teaching opportunities and learning resources. I have no regrets coming to UCL over the other places because I'm having such a great time here. During your 6 years here, you're split up into different sections of studying. So your first 3 years are preclinical and are all based in sort of lectures and small group work. So your first 2 years are all around the central campus, learning about the core science and pathology of medicine. In the first 2 years, it's really great that you have anatomy sessions. So these are, you get given a cadaver per about 6 students, and you are learning how to dissect, learning about the anatomy in such small groups, and I think that's a really great opportunity and really well taught. In your 3rd year, you do your specialist BSc subject, and then in your 4th, 5th and 6th year, you're on clinical rotations in hospitals. Everybody has to do a BSc in their 3rd year, so basically a science degree in their 3rd year, which gives you so many great opportunities to go and work with your supervisor and do a dissertation project on your choice. My supervisor last year was called Dr. John Hurst, and he's a really important guy in COPD research, so it was a really great opportunity that I got to work with him. I'm really enjoying 4th year, to be honest. It's a great way to kind of put into practice all of the theory and the knowledge that you've learned over your first 3 years and actually see it in real life patients. I think all of the rotations are meant to be quite good. I think some of the hospitals are good for different things and are bad for different things. I think the rotation that I like the most so far has been anaesthetics. It's a really great hands-on opportunity to see what being in theatre's like. My current base is at University College Hospital, the big green glass building opposite Euston Station, which looks really swanky and new. And I have a 4-month placement there. In 4th, 5th and final year, you get examined in practical examinations called OSCEs, which is something that we haven't done before. It's a new thing, so I'm going to be a bit nervous for that. And these are basically clinical scenarios where you'll have about 30 seconds to read a scenario. For example, Mr. X has come into hospital with some tummy pain. Please examine him and speak to the examiner about what you find. And you'll have about 10 minutes to go into the station and examine the patient, chat to them, and then present your findings to the doctor. So I've got that coming this year, which could be a bit nerve-wracking. I wanted to study medicine because I really liked the combination of learning a scientific topic in depth, but also you get the human interaction and working within a team. So I think it's quite competitive to get into UCL. I think there's about 1,500 to 2,000 applicants per year and only about 300 places. When people are looking at doing the BMAT, I think they probably need to make sure they have a good scientific understanding in all of the 4 main sciences and maths, and then also have a kind of topic of interest in some sort of humanities subject that you could think about writing in the essay. For prospective students looking to come to interview here, I definitely say to read up or look out for kind of recent junior doctor stuff that's been in the news. It's been really big recently with the new junior doctor contracts being imposed. I'm from Newcastle, which is in the northeast of England. So when I first came to London, it was quite a big step. You know, a lot of my friends lived about an hour train away, so they could go home quite easily. Whereas for me, it was about a 4-hour train journey and also really expensive. So I didn't get to go home much in the first term. But I think in a way that was good because it made me stay and make friends and be sociable. And now it's perfectly fine. I don't really miss home at all. So I think what really helped with the difficult transition from school is that you get a mums and dads event, so you get paired with a medic parent who is able to offer you advice about what sort of parts of the syllabus you need to know, what to worry about, what not to worry about. Earlier this year, I got to scrub into a surgery, which is where you basically spend about 7 minutes washing your hands, and you have to hold them up like this, and then you put your gown on and your mask and so on. And then I got to help out with the surgery by kind of just holding some tongs and sort of spreading the skin apart. Sorry to sound a bit gross, but that was really cool because I kind of felt like I was actually helping and actually getting involved with something.
If you're interested in hearing more about the world's top universities, don't forget to subscribe.